talk on life skills for adolescents. Also take this opportunity to welcome Dr. Bharat sir, who is instrumental in connecting us with you for this talk. And I also welcome all the attendees who have joined on both Cisco WebEx and YouTube platform. At the outset, let me give a brief overview of Madam's achievements before actually starting the talk. Dr. Vrinda is a professor and consultant of Awake Clinic at Niman's Center for Wellbeing, Bangalore. Madam has done her MA, MPhil and PhD from Niman's. She is an expert in life skills and developed cascading promotive mental health life skill model for adolescents in schools. And this model has been upscaled to schools by Department of Education, Government of Karnataka and Kolar district. Nearly 80,000 students have got benefited by this particular program model. The model has been integrated in schools in different states. White Swan Foundation, Central Tibetan Administration Schools, Himachal Pradesh, Adi Chunchikil Medical College and Science College as competence-based curriculum for UG graduates, UG students. She has developed community-based framework model in Awake Special Clinic for women with intimate partner violence in mental health setting to provide comprehensive and specialized psychosocial counseling for women survivors of partner violence and domestic violence. She has several extramural and intramural projects to her credit as a principal investigator, especially the funding from ICMR, ICSSR, Government of Karnataka, UNICEF, National Commission for Women, and Department of Women and Child Development, Government of Karnataka. Her research interests are women mental health, enhancement of psychosocial competencies through life skills for children and adolescents in schools, psychological interventions with children and adolescents infected with perinatal HIV, AIDS, child sexual abuse, evidence-based practice in psychosocial interventions, scale standardization and designing adaptive interventions to enhance the mental health of patients and their families. She has been appointed by the Government of Karnataka as an expert member for drafting a standard operating procedure for special treatment unit for rape victims and also Santwana Kendras and government homes for women under the Department of Women and Child Development, Government of Karnataka. She has been involved in several technical advisory and scientific committees as an expert member in ICMR, UNFPA, UNICEF, National Board for Workers, Education and Development, Ministry of Labor and Employment, Government of India. She is also a member of editorial board of many national and international scientific journals of repute. She has published over 80 scientific articles in journals, 40 chapters in books, magazines, and manuals in the areas of life skills. And yeah, with this very brief introduction, I request Madam to deliver her talk. Once again, welcome to you, Madam.
Thank you, sir.
For your presentation.
Thank you, sir, once again for inviting me for this webinar on the eve of World Mental Health Day. I think this has been going on from last 3 days. Many of our faculties from the NIMHANS have been taken several mental health issues for the general public and also targeted to the young audience like an adolescent and youth. Today I have been briefly talking about why the life skills education is important for the young adolescent and the youth, and how these life skills programs can be integrated into the school's curriculum and which can be used by different stakeholders like teachers, it could be, and also health sectors, people, those who are working in hospitals can also introduce this, and NGO personals and the school counselors. So with this, I welcome all the participants for this today's webinar on life skill educations for the adolescent. Um, I uh, hope can you see the screen?
Yes,
Screen?
ma'am.
Yeah, yeah. Um, uh, about me is already been introduced by the program organizer. Why is that the life skills education is important for the adolescent youngsters? As we know that adolescent is a period of transitions with the significant changes in the physical, psychological, and the sexual maturations. It also a time when young people begins to form their own values and the belief and develop an adult identity. Most of the young people, as you know, these undergo these transitions very successfully. It is also widely acknowledged that the early years of life has a major influence on the adolescent mental health and cognitive functioning. So when it comes to the um, adolescent and the young youth, some of the charms and the challenges that happens during the transitions period of adolescent. What are the charms of growing up? As we know that the physical and the emotional mental health that happens, and the children start forming their own identity. They develop in new thoughts, feelings, and also it's a time for the adolescent period is a time for forming in new friendships and striving for the autonomy and the seeking approval from the friends and the peers. When it comes to the challenges that occurs during this period that need to be handled by the school teachers, it could be by the parents and by the counselors, uh, very crucials are that during this period, I think a lot of confusion that happens during this period regarding the discomfort and the confusion regarding the bodily changes that happens for the boys and the girls, and also mood swings because of the hormonal changes, and also adolescent they face the peer pressures and the competitions and also attractions toward the opposite sex, and early sexual experimentations is common during this period of time. And apart from that, stress related to the relationship with the parents and the generation gap, as we know that this is the 21st century, where there are a lot of generation gaps between the young children and the parents who are having a difficulty even adapting to the technological tools that, and also there is a value conflict between the parents and the teachers. And also during this period, especially adolescent, they face a lot of academic pressures that is put by oneself, by themselves sometimes, and also by the others. It could be a teachers, and also it could be a parents, and it could be a neighbors. They put a lot of pressures on them to excel in their academic. And nowadays educational system also, if you take it, it's more towards the uh, achievement oriented in terms of academic related, not focusing more on extracurricular or co-curricular activities. So that puts a lot of pressure and the stress on the youngsters. um, when it comes to the issues of the adolescent in India, as we know that this is the data based on the research published in scientific journal in India, that 1 in 5 smokers are between the age group of 13 to 15 years, where youngsters start experimenting with the substances due to the peer pressures and also out of curiosity. And 1 in 4 girls between 15 to 19 years get married, especially if you take in rural part of the India, and in Karnataka, if you take northern part of the Karnataka, and also in a semi-urban places where girls are denied of their educations and they get married at an early age as soon as they attain menarche. And every second child under the age of 5 is malnourished, And also 50% of the mental health problems in adolescent occurs among the adolescent occurs during the adolescent period. So there is a need for mental health professionals and also non-mental health professionals to address these issues. And suicide is the leading cause of the death, and India is the highest when you considered globally also. 2 out of 3 children are sexually abused. This we are aware of that. Every day, if you look at the print media or the visual media, they're reporting of sexual abuse against to the children. Despite of the changes in the policies in the program, we are unable to prevent it because of the lack of awareness, and also people are do not come forward and talk about this. And many times girls do not complete their primary educations at all. When you consider from the gender angle, young girls are not allowed to continue their educations. Priorities are always been given to the boys in the patriarchal society, be it India or elsewhere. And the school dropout that occurs generally, 60% of the school drop that occurs between the age group of 5 and the 15 years. So, considering this, so most of the risk taking behavior, as I mentioned in the previous slide, and also based on the scientific finding from the research outcome, the risk taking behavior and the psychological problems among the children that emerge during the period which can be preventable and which can be addressed by preventive and the promotive mental health programs that can be integrated into the schools and the colleges. For adolescents to successfully transit from the adulthood and adaptation to the day-to-day challenges, the children especially, they require and they should also develop a skills. So enhancing life skills before their behavior escalate to the point of needing help for the mental health professionals. So they need to be taught to how to handle the day-to-day stressors and to deals with the day-to-day stressors. They requires an array of life skills. What is life skills? So I have been asked to talk about life skills. Life skills is the concept that is developed by World Health Organization in 1995, where they defined the life skills as the abilities for adaptive and the positive behavior that enables individual to deal effectively with the demands and the challenges of everyday life. So why is that the life skills are important? It's important for independent living, development of the competency to handle the day-to-day stressors, and fulfills one's core aspirations of the individual, and to enhance the capability and making healthy choices. Uh, as an individual, we get a lot of choices to make in a day-to-day life, but choosing the best choices, healthy choices, so one need to have a life skills and also enhance the well-being of the individual. One requires life skills. So what are those life skills are? WHO has identified 10 life skills which are grouped under the 3 domains as a social skills, emotional skills, and the thinking skills. If you take what are the social skills are self-awareness, effective communication skills, interpersonal relationship skills, empathy. Emotional skills that one requires are coping with the emotions and coping with the stressors. When it comes to the thinking skill, one requires a critical thinking skill, creative thinking skills, and the problem solving skills and decisions making skills. And all these 10 skills, which are put under the 3 domains, are interlinked. Out of the 10 skills, if you take critical thinking and the creative thinking skills, are called mother skills, which are linked to all the 8 skills. For example, if one want to make a decisions or to solve a problem or to deal with the emotions of difficult situation, they requires to critically analyze the situation. Apart from that, they also requires a creativity to solve that. So these 2 skills are we call them mother skills for the all set of all 8 skills to functions very cardially. So if you take in one by one, I wanted to address here simply that how what are these 10 skills are, and how best one can enhance these skills to overcome day-to-day difficulties are self-awareness. Self-awareness something like recognitions of ourselves, our character, our strength and the weaknesses, what is our desires and dislikes. Self-awareness is a prerequisite for effective communication, interpersonal relationship, and developing a healthy empathy. And developing self awareness skills is important for learning about yourself and discovering your true capabilities. And self awareness skills not only enables you to understand your own personality but also help you to understand other people, their perceptions about you and your response to their actions and their behavior. So, how the self awareness can be enhanced? If you take a Johari window, it helps us in understanding yourself or oneself. So, Johari window is a psychological tool which is used to help the individual to better understand themselves and the relationship with others. It's a visual representations of different aspects of an individual personality that are known or unknown to themselves and others. If we take a left side of my presentation, it represents a four quadrant, each one represented different areas of self-awareness. If we take in open self, that is known self, it represents informations about oneself that is unknown to the individual but known to the others. This includes behavior or attitude other can see but the individual is unaware of that. And if you take a blind self, informations about oneself that is unknown to the self but known to the others. And hidden self is something known to the individual but not known to the others. It includes personal feelings, experiences that are not shared with the others. It can be shared only with the person whom the individual has a trustful relationship, and it's something which is a private informations that can be shared with the friend, a friend, or it could be a counselors, or it could be a teacher or a parents about informations that disclose to them only, which need not necessary to disclose others. Unknown self is the informations about oneself that is unknown to the both individual and others. It may include things like an unconscious motivations, desires, or a fears. So it's a powerful tool, Johari window, to increase self-awareness and interpersonal and the communication skills. By exploring blind self, that is, it's unknown to the self but known to the others aspect of our life, we can enhance our understanding of who we are and how we interact with others. How can we enhance our blind self? Most of the time, we don't know how we behave, interact, what my strength and the limitations are, which known to the others but unknown to me, which can be enhanced, as I mentioned, blind self through active listening and constructive feedback. Many times, it's difficult for us to take a constructive feedback from the parents. It could be a teacher, or it could be a friends regarding the behavior. Some of the behavior, it could be a good behavior or a bad behavior, or some of the talent what we are having, or some of the limitations what we are having. Uh, those aspects of the feedback can be taken constructively from them, without having mm, any fear, and also reflecting upon oneself, you know, and we can expand our open self and reduce the blind spot, which leading to more authentic and the meaningful relationship. And also it gives an contentment, and also it gives a satisfaction to us. The second thing is that the empathy is the skill, it's an ability to imagine what life is like for another person, even in a situation that may not be similar with. It helps us to understand and accept others and their behavior that may be different from us. This can improve social interactions especially in situation of ethnic and the cultural diversity. Empathy can also encourage to adoption of a running nurturing and attitudes towards the people in need of care and assistance or a tolerance and understanding, as in case, for example, persons who is suffering from the AIDS, and also person with the mental illness or LGBT community, towards whom we need to have a tolerance and empathy towards them. What are the signs of that one is lacking empathy? For example, extremely critical towards others, never apologizing for the mistakes. It could be or a misunderstanding and having a revengeful attitude and retaliation behavior, and always not listening to the other's opinion and the views, and confused with the other feelings, and lack of responsibility and regret for hurting people, and always being the receiver and not giving, and always being critical and judgmental towards others and blaming. These are all the some of the signs that one could understand that the person, he or she, lacking an empathy. And how to improve empathy? There are many ways that the one can improve empathy. Empathy is, as I told you, is putting ourselves in somebody else's shoes and understanding what he or she is going through. These skills cannot be taught actually. It need to be experienced. So, what are the ways that the one can improve empathy? Is focus on similarity, not on the differences. Every single one of us having a biases, as we understand, isn't it? There are always a way to put other people into the boxes and making assumptions about them based on the stereotype or a cultural stigma that we are having. Doing this to the others keep us from understanding other people's individuality and the unique qualities, and it can also help us to understand them. And the second is that put yourself in somebody else's shoes to practice this skills. I know we call it as a perspective taking, where we consciously putting ourselves in someone else's shoes and imagining what challenges that he or she or might be facing, how it could be making them to feel and think and behave. This mindset, this shifts to ensure that we stay in an empathetic state by attempting to imagine what it would be like to experience what they are going through, help us to gain a better understanding things from their view and their perspective, rather than every time putting our own opinion and not allowing other people to express it. And third thing is listening carefully and also sharing. It's a powerful tool that can also demonstrate empathy. When we practice active listening, uh, we are listening with the purpose and also with a deep desire to want to really hear what someone else is saying. Empathetic people take the time to understand the other person's priority and the motivation. To do this, it is important to stay focused and use an active listening, and uh, and also gain insight into that, and also be genuine and curious about others, and also being non-judgmental. Most of the time unempathetic people always being judgmental and blaming others, and always uh, target them by doing right or wrong thing, by saying what is right and what wrong thing, never putting allowing or putting themselves in their perspective to understand what they are going through. So by being non-judgmental, I think you are allowing the persons to express what he or she is undergoing, and also help us to validate other person's feelings. And third aspect, fourth, third skill is life skill is effective communication. It's an ability to express ourselves both verbally and non-verbally in an appropriate manner. This means being able to express our desire. It could be opinion, it could be fears, and seek an assistant and active. advice in times of need. What are the component of the communication skills are? It's effective listening and the body languages, the way we show to express our views, and also sharing feedbacks and receiving the feedback, and also other non-verbal component are the kind of a volume and the tempo, the tone which we use it while interacting with the people, and respecting and openness. These are all the effective, what is the component of the effective communication skills. And also 7 C's which are important for the effective communication skills for the youngsters. What are those 7 components are, concretely speaking about that? And your communications, whenever you are expressing any thought or an ideas, it should be complete, it should not be vague, and it should be given in concise and the precise manner. And you also have to need to be considerate and courteous, and also clear about what you are talking or putting your, when you are putting your views and the ideas to the other people. It could be a public forum, or it could be in one-to-one interactions, or when you are communicating with the teachers, it could be a peer, or it could be with your parents. And interpersonal relationships are skills that help us to understand our relationship with the relevant others and relate in a positive and the reciprocal manner with them. It helps us to maintain relationship with the friends, family members, and also be able to end the relationship and constructively. Being able to maintain friendly relationship with the family, friends, peer can be a great source of support. Uh, what are the component of the interpersonal relationship are trust. Without trust, one cannot uh, establish a relationship or maintain a relationship, and the honesty and commitment to the relationship, and also one need to contribute to sustain that relationship, and there need to be a reciprocal communications between the two, and respect, which is important part of the relationship, and also supportness, fairness, and equality. Any relationship which is dominant, um, never allow the person to reciprocate each other's, that it ends up in breaking of such relationship. And listening and having a realistic expectations in the relationship, and accepting each other's strength in the limitations, and being non-judgmental are the component of the interpersonal relationship that one should have. And some of the barriers that sometimes uh, results in breaking of the relationship. What are those barriers? Are always been blaming, shyness, and self-centeredness. Never been I-oriented, not we-oriented. When it comes to the sharing, it could be respecting, it could be listening to the others' views, it could be the person always been self-centered persons, never been able to sustain or maintain any kind of relationship, and being critical and the judgmental, always criticizing, never appreciate the small changes or a thing that happens, and doubting and the suspiciousness. These are all the some of the indicators that shows that the person lack an interpersonal relationship, that requires one to alter the way they interact with the people. And coping with them emotions, I think, as we know that as I mentioned in the beginning itself, as an adolescent or youngsters or adult like us, we go through a lot of emotions, isn't it? These are all the part and the parcel of our life, that we need to deal with that. It's an ability which involves that we need to recognize the emotions in oneself and also with the others. Being aware of our emotions that influences behavior, being able to respond to emotions appropriately. If you, if, how would I know that how my thoughts, the feelings, and the behavior are interlinked in a positive way? For example, in our mind, every time this thought, behavior, and feelings, these 3 components are always being back of my mind, our mind, it's always been playing. Thought is something like what we think, And for example, if a person's go within a positive thought of, attending an exams, could be that if he go within a positive confident mind that he read well, that he can reproduce and the recall whatever he has studied in the past, with the confident mind that he can do it, then his behavior is going to be that positive behavior, that he can recall everything without any anxiety and the fear, and write exams. And emotions is that he may not be feel anxious or fearful, and do not feel devastated, that he feel good about it, and he can reproduce whatever he has studied in the exam and do well. The positive thought is always been linked to the behavior in emotions. If the person thinks that he has not, despite of reading well, suddenly the thought of not studied well, in the last minute if you get that, the behavior is going to be that, that he gets anxious, and feel fearful, and start feeling forgetting everything. The emotions are something like he gets a panic attack, feel helpless and forget everything. So what is that the youngsters in a difficult situations are an adult, we always face challenging situations. It could be situations may be a simple or a complex situations. One need to have a positive thought. If he thinks in a positive way, then the behavior going to be positive, and emotions also going to be the positive, that one can excel to overcome that difficulties in an adaptive way. How could there are different kinds of emotions that we go through. The youngsters usually they go through the anxiety and the fear and the sadness and the anger, so which is common emotions that one need to learn to how to handle this. Some of the things that that one can do to overcome the anxiety and the fear, it could be practicing deep breathing exercise. So doing breathing exercise on a regular basis to keep your everyday anxiety at a low level, and in anxiety provoking situations, it gives an immediate relief so that you can think clearly to overcome the situations. Practicing distraction before that, what is that the deep breathing exercise one can do? For example, during even exam, youngsters or students, if they're sitting in an examination hall, having in some amount of fear is unhealthy, isn't it? One needn't have to be overconfident that he will do well, isn't it? uh, Even when you're giving a public speak, I think having in some amount of anxiety is a good for that. It produces a good outcome. But we need to learn to how to handle this anxiety. Is that what is the deep breathing exercise one can do? Is that taking 5 counts, inhale deeply so that one person tummy will come up, and exhale it slowly. If persons can, wherever the person is sitting, even in a standing positions, he can quietly can practice this deep breathing exercise for a while, which helps us to bring down the hormonal changes that happens during the difficult situations, and it helps us to calm our mind and relaxes us, so that the person uh, can perform well. It could be in the exams, or if he's going giving in a public speak, whatever it could be, that can be addressed in a comfortable way. And also practicing in distractions by counting 1 to 10 slowly backward, and also repeating it 2 to 3 times, and also having and learning to know how to do the thought stopping techniques, where that help us to go of the thought that causes you to feel anxious, and change them to the thought that help you to feel peaceful. Notice the thought that causing anxiety and tell yourself loudly to stop. I think sometimes it helps you to overcome the negative thought, and sometimes saying what if. When you feel anxious, you can use the questions, what is the worst thing that could happen to you, to help you to lower the anxiety. and accepting that you cannot control every situations or everything, and also thinking positively by making an effort to replace negative thoughts with the positive one, which will reduce your anxiety level. Example, I am strong, by saying, giving an auto suggestions to yourself, and challenge help me to grow. I can do well, or I can control myself, and things will be fine. Next time I will do my best. By giving this kind of a positive strokes or a positive thought, that helps us to overcome the anxiety and also a fear, and seeing the bigger pictures. Sometimes we focus on closely on one or two small detail of our situations, that we lose a sight of the bigger pictures. Shifting the focus from to the bigger pictures can help you to more peaceful, and also talk it out. Expressing anxiety by talking it, it helps us to release the uh, fear and the anxiety, and also visualizing a peaceful situations in your mind, even it is not really happening, can help you to release your anxiety. And controlling the anger, this is the most common thing that the adolescent face, and most of the time they end up in having a maladaptive way of dealing with the negative emotions like anger, by showing anger towards oneself, or indulging in harmful behavior, harmful impulsive behavior, like deliberately cutting their wrist, it could be, or breaking things. We tend to see that youngsters are coming like this kind of a self-destructive behavior in our clinical services, where we teach them to how to channelize their anger and how to control their emotions. Some of the things that can be done to control the anger is, taking a deep breath, to tell yourself calm down and then relax. And I also mentioned to do a deep breathing exercise, and closing your eyes and count 1 to 10 forward and the backward. This may not address the anger directly, but it can minimize the damage one will do when he or she angry. And also give yourself some time and the space alone, move away physically from the situations that makes you angry, and imagine a relaxing experiences by closing your eyes and travel there in your own mind. And expressing anger in an assertive way and not in an aggressive manner is an healthiest way to express anger. Many times people use an aggression, sometimes non-assertive behavior, uh, mm, that end up in um, undesired outcome. So one need to use an assertive way of expressing uh, that their anger without destroying things. And when you're angry with the person, convey clearly that you are upset and you do not want to discuss the issues right as you are angry. Indicates a specific time later where you could deal with the issues by discussing with them, and express your opinion calmly, using I statement to share the opinion or a perspective without placing the blame on someone else. For example, instead of saying, "You made me angry," you can say that I feel angry or I feel hurt. I think that we should talk about these situations. This gives an healthy way of uh, resolving the issues by discussing with them that what made or what caused and uh, anger towards them, without indulging in an aggressive behavior or self-destructive behavior. So as we know that many times adolescent indulge in self-destructive behavior, that's unhealthy way of dealing with the and anger. And also most of the time, uh, many times youngsters also undergo a lot of emotional pain. This could be under the background of uh, uh, dysfunctional family, or sometimes a relationship breakup, and also difficulty related to the academic, it could be, or any other issues sometimes which trouble them. So many times they avoid sharing their difficult emotions or emotional pain with the teacher or a friends, assuming that what they might think about. They may not believe in their stories. For example, if a girl undergoing uh, sexual abuse, they may not express it, assuming that the person do not believe them. Or having an academic difficulty, sometimes um, it's very difficult for the child to express it with the teachers, assuming that they may label it them in a certain word. So internalizing these problems results in the latest stage uh, uh, with the psychological problems. It could be anxiety or it could be depression. And sometimes if the trauma is so severe, the child may end up having post-traumatic stress disorder. So it is very important for the children, if they are undergoing any sort of the emotional pain or an issue, I think they should stop worrying them and accept that feelings, and write down their feelings in their personal diary, and share those concerns, what are the difficulties that bothering them, with the persons whom they believe disclose difficulties with them. And if they feel that these are all the pains that are affecting their mind and body and unable to um, perform well, and carry the day-to-day activities, then it's high time for the youngsters to seek out for the psychiatrists or a counselors or a school mental health professionals, for further help. And coping with the stress is it's an ability to recognize the source of a stress in our life, and its effects on us on acting in way to help to control our levels of stress. This may involve taking actions to reduce some stress, for example, changes in the physical environment, life skills, or learning to relax. So some of the bouncing back techniques that the youngsters should follow in a healthy way of dealing with the stress is talking it out and taking control of their situations and practicing time management skill. Many times, the sources of the stress that happens mainly because of the lack of time management skill for the youngsters, even for the adult like us. So one should learn to how to manage their skills effectively by using critical thinking. It could be creative thinking, it could be, and also decisions making skills, and developing a sense of humor. One of the barriers to the stress reduction is the temptations to take the things too easily. I think it's okay to back up from your intensity and see the humors in a difficult situation. You can laugh at yourself, don't put your self esteem down, and take regular break from the routine work or get away when you can. Engage in a hobby, listen to the music, and sometimes spending time with a pet, and that relieves the stress to you. And getting an adequate sleep and having consistent sleeping schedule as much as possible, and staying positive and lowering our own unrealistic expectations which we have put on us is very important. And as I mentioned, breathing exercise it could be, and setting up small goals and breaking the larger task into the smaller achievable task, that also reduces the stress, and using a problem solving strategies to help the problems and look for the alternative ways of dealing with the solutions. And also other way of dealing with the stress is practicing the yoga, could be meditations, listening to the music, and the exercises that depends upon the personality of the individual can adopt any one of these things that helps them to relieve the stress. At the end of the day, the one way of dealing with the stress is again is that using problem solving skills to handle the situations, That's one way of healthy way of dealing with that. And other component which I have mentioned is also helps us to distract from them. But the end one need to use is problem solving skills to address the source of the stress successfully. And critical thinking skill, it's an ability to analyze the informations and experience in an objective manner. It can contribute to healthy living by helping us in recognizing and assessing the focus that influence our attitude, behavior, such as values, peer pressure, and the media. It includes ability to engage in reflective and independent thinking. It helps in quicker decisions making skills. And its creativity thinking skill is an ability that helps us to look beyond our direct experiences and addresses the issues in a perspective which is important, it's different from the obvious or the norm. It contributes to the problem solving, decisions making by enabling us to explore alternatives and various consequences of our actions or non-actions. So how we can um, enhance our creative thinking skill by means of engaging in reflections, having flexibility. Most of the time, we are very rigid, that do not allow us to think the issues in a different perspective, and openness to the new ideas and the um, new set of ideas, and sometimes making mistakes and accepting is also okay, not judging others, and using our own imagination and observation skills that also enable us to enhance one's own creative thinking skills. Decisions making skill is the process of making assessment of an issues by considering all the positive and available options and the effect different decisions might have on them. It helps us to deal constructively with the issues in our life and take appropriate actions. It teaches us to be proactive in making decisions, choices about the decisions, our life in relation to healthy assessment of different options available, and in determining what effect these different decisions are likely to have on us. Uh, as we all in our day-to-day life, from morning till evening, make a lot of decisions. Decisions, it could be wearing a particular dress, it could be or decisions regarding, for example, youngsters after the 10th, passing out of 10th standard, which discipline they have to go, or choosing in a career, it could be. Uh, uh, these are all the some of the difficult decisions we make, and some of the decisions we make it simple decision that occurs in our mind. We needn't have to follow some of the steps. It happens in our mind itself. When decisions that related to career, it could be choosing in any particular course, it could be, or somebody pressurizes for a youngsters to smoke a cigarette or a bunk a class, or indulging in an unhealthy behavior, it could be. So these are all these challenging situations. The one need to have make it decisions based on certain steps, isn't it? One need to make it. What are those steps that one need to follow while making a bigger decisions, which has a long implications on our life, which cannot be reverse, reversed. The outcome of those decisions cannot be reversed. I think one has to own the responsibility of that, be it a good outcome, be it a bad outcome. So, having said that, one need to have one need to follow the steps to make a decisions. What are those steps that one need to follow while making the decisions? Is that, step one is that identifying the situations or the problems for which one need to make a decisions, and collect informations as much as possible about that situations or a issues that need to be solved, and identify possible solutions. Think carefully about all the possible alternatives that you could choose from. Usually, more choices are available than you think. talk to the others and explore the options to help you see more choices and examine the alternatives. Look at each of the possible solutions that you have listed and think about the advantages and the disadvantage of each of the choices or an options which one has enumerated based on advice of the people, it could be, and also considered how you feel about each of them. Discuss with the people you think can help. Think about the worst that can happen, and all the decisions have good or a bad consequences. Then choose the one alternative that's suitable to the situations. Follow your priority. Decide on one alternative from your list of the alternatives that one has generated. Choose the decisions that seems most appropriate based on uh, your knowledge. It could be values, moral, and the future goals, and implement the decisions. Most of the time we tend to enumerate a lot of solutions for that. We will not implement the uh, things that need to happen. Person just start procrastinating, and at the end the minute the persons end up in facing a lot of stresses, and also indulge in the behavior which ends up in undesired behavior. So it's better that implement whatever the decisions you have done and evaluate your decisions. What is the good choice for you? What did you learn from that choices, and what will you do next time? For the outcome what you expected, comparing can help you to see your strength, weaknesses, and help you to make better decisions in the future. Some of the do's one need to think of while making decisions are: avoid making decisions when you are under stress, avoid making decisions impulsively without thinking, don't depend on other for making decisions. Most of the time when the youngsters or even adult, when they are in a difficult situations, it could be taking a failure, or handling in a financial distress, it could be, or for an adult, having dysfunctional family when it comes to the marital discard, or facing stresses in the workplaces, they tend to impulsively uh, attempt suicide or commit suicide without thinking about it. And even youngsters do that, when the results are out, exam results are out, the immediate impulsive reactions for them to handle the stress or coping with that, emotions of the failure, rejections, and also the amount of the pressure they put on oneself, that results in suddenly acting upon himself impulsively, committing suicide or attempting suicide. I think whenever one distressed, better, avoid making any decisions at all. Take a control of the situations, and be with the people, for a while, and express your difficulties rather than indulging harmful way of dealing with a source of dealing with the problem or a stressful situations by making impulsive decisions. And problem solving is, it helps us to deal constructively with the problems in our life. Significant problems that are left unresolved can cause, as we know, that the mental distress and leading to the physical stress. Unresolved problems, most of the time lead to mental and the physical stressors. So as I mentioned, like a decisions making, bigger problems need to be solved with certain techniques. One need to thorough with that. Techniques are, there are six steps are there while making the problems. Is defining the problems, understand what the problem is, and what should be done to address the problem. What are the resources available to address the problem is first steps in the problem solving. Second step is identifying possible solutions to the problem, which include thinking carefully about all the alternative solution that you have. You can come up with that, talk to others and explore and identify as many alternative solutions to the problem as possible. Many times, youngsters or some people, they do not approach people to resolve the problems. They always think in a monotonous way of resolving the problems, having fewer options. It's better to, discuss with the people and explore the solutions for the problems. Once you are explored solutions for the problems, weighs the pros and the cons of each of the alternative solutions. Look at each of the possible solution that you have listed and think about the advantage and the disadvantage of each of the solution. Consider how you can feel about each of them. Discuss with the people you think can help. Anticipate the possible outcome for each of the solution and select a solution and act on it. Choose a best solution. This choice will based on your information, advantage, disadvantage, and also values in the feelings, and evaluate the results. Start over if necessary. What is good solutions for your problem? What did you learn from that? What will you do next time? For the outcome, what you expected. Comparing can help you to see your strength and the weaknesses, and also help you make better decisions on solving the problems in the future. These are all some of the steps that one can use it while resolving or solving difficult problem. When it comes to the life skill educations, who can facilitate this life skills? The life skills can be taught by the teachers. It could be school counselors, peer people like peer educators, community agencies, religions leader, and healthcare professional and others can teach these life skills in the classrooms or in a community oriented organization. And what is the model of the life skill educations? Some of the examples what I have given in my presentations about these 10 life skills. These skills are usually taught using an experiential learning model. The WHS model of teaching life skill educations uses this model of experiential learning model, not a lecture method or a didactic method, where there is no scope for one to learn and practice the skills. In an experiential model of teaching life skills that uses experiences where the activity the children will do, they share the results, reaction, and observations publicly. In the process, by discussing, looking at the experience, and they also reflect and generalize and connect to the experiences with a real example and apply what that he or she has learned to a similar or a different situations and practice it. In an experiential model, I think children they reflect upon the skills and they apply the skills and the real life situation. This is the model that one adapt to teach the life skill educations. And there are different methodology that one could use to enhance this set of 10 life skills which I have already been briefly elaborated. The 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 life skill facilitators, to become a life skill facilitator, one need to undergo training of in an experiential methodology using different approaches or a pedagogy of teaching. It includes group work, discussions, brainstorming, role play, educational games, debates, field study, introspections, and quiz. These are all the different pedagogy that can be used to teach the life skill educations. And what are the setting that one can be used? It can be used in the schools, life skill education. It can be used in the colleges, a community. It can be used with the three children who are most vulnerable children. It can be used it can be used in the hospital setting, where the children suffering from chronic illnesses like perinatal HIV/AIDS. For them, they undergo a lot of difficulties and the challenges which, compared to the normal children, for them to handle difficult situation, they requires life skills. It can be done in a hospital setting, having a group approaches, and it can be done in an NGO and also in a shelter home where children who are in foster care children who are orphaned, living in a shelter home because of the difficult background, to whom the counselors can teach these life skill educations. Uh, in a NIMHANS, if as expertise as an expert in this area, I have developed a model of promoting life skill educations for the school children, using teachers and the counselors as a facilitator. This is a cascading model that which we have derived here, which has 52 activities um, on various aspects that adolescent requires skill using life skill educations. Some of the component of that the areas which we focused in our life skills promoting mental health life skills model is that helping the children to handle the academic related issues, handling a pressure, managing the substance abuse, addressing the internet addictions. I think this is something a global issues now. Handling the internet problems, which earlier it was not there. During the COVID and the post-COVID, the research data also says that in many children's, even adult populations have undergoing the problem of addiction related to the different technological tools. It could be gaming, it could be, or it could be using excessively a mobile gadget. Um, on many aspects, one can say that they requires a skill. And other component is understanding the children's about their reproductive health issues, relationship difficulties, and also handling academic related pressure, suicide preventions, and how to enhance the motivations to study. It could be making a career goal. And these are all the modules, which there are 12 modules are there, and totally 52 activities are there. Each modules are having 15 to 20 activities that start from the school, start from the for children studying in the 7th standard to the till their 12th standard. These skills, life skills, are taught, addressing the issues which have already been said in the schools and in the colleges by the teachers can do. And also um, school counselors can adopt this model in the schools. As of now, I think this model is available in English, Hindi, and we have already trained around uh, 4 to 5,000 teachers in the Karnataka, and also nearly 80 to 1 lakh children have been benefited from this program. And also this program, life skills program, which NIMHANS uh, has developed, already been integrated in the school curriculum in some part of the schools, government schools, and also in northern part of the private schools, and also for UG level of MBBS schools and MBBS colleges also been integrated. So only thing is that requires to use this life skills model is that we regularly conduct a week experiential learning training programs where teachers can be trained as an facilitators to how to do these activities in the schools and integrate this model in that. So anybody who are interested, can approach us, especially me, so that you can get trained as a facilitator and go back and implement these schools. Without the training, it would be difficult for the stakeholders who are present here to implement this program. And also, we also conduct these programs. Some of our trainees go and do it directly with the children. If the children are interested, definitely they could write to us and be a part of this program in future. Thank you very much for the organizer for giving me an opportunity to, to talk about this topic. And if the audience here has any questions or anything to say, they're free for that. And now I'm requesting the floor to raise the questions, or any feedback to be given can be given to me. Thank you.
Madam, thank you very much for a
Yes.
very informative and scholarly talk on life skills for adolescents. In fact, life skills education is very much required this in the age of mobiles and social media. Well, your talk covered many of the things that students should follow, especially 7 C's of effective communication, coping with emotion, ways to deal with emotions and creative thinking skills, decision making, experiential learning and problem solving. All are very important, especially for the youth of 2020. Madam, uh, behalf of KSTA and all the attendees, I'm very thankful to you. In fact, one question I have,
Yes, sir.
you see self-decision,
Yeah.
adolescents won't be able to take. They
Yeah.
have to talk to their parents or teachers.
Yes, sir.
Is it advisable to consult and then take the decision instead of going directly taking self-decision?
Yes. I think it's a good questions what you have asked, sir. The simple decisions, for example, what dress to be worn today, or something, going out once in a while with a friend. It could be attending a birthday parties. I think those are all the small decisions. I think children could able to do that, isn't it? Until and unless, if you are in a subtle way monitoring their behavior, and if you believe them, they can do that. Some of the complex decisions, as you mentioned, related to career, it could be, isn't it? Many times I think, in our culture also, we don't allow them to do, isn't it? Parents are the one who makes the decisions for them, but not considering the child's strength or limitations or a view. uh, um, However, having said that, as you mentioned, something related to that, I think child may not be able to do that. But as a parents, as a teacher, it's important for the child to make them to understand that the what the strength and the child, limitation the child has, and giving that view to the child, and allow the child to understand about his own strength and the limitations, and showing them that what are the benefits and outcomes he might have in future, choosing certain things, and allowing him to, facilitating and allowing him together to make a decisions is good. And rather than, neither making solely parents, decisions for that, or allowing the child to make that. And it's always should be in a democratic way. I think that leads and fetch a good outcome. Mm, that's what I intend to say. Many times parents ask, can I allow my child to make a decision? Of course, child can make a decisions, but make the child partner in that and facilitate for that, rather than being dominant with them. Hope I understand. I hope I.
Yeah. Madam, you told life skill trainers program for teachers are being conducted.
Yes, sir.
Can KCA host such a program in our own campus, or should all the participants come only to?
Definitely, sir. Usually, as I mentioned, if you want, just I will show you our module. I'll just get up for a while and I'll show you our module. Yeah. So this is what our book is, sir. This is about promotion of the mental health well-being of adolescent in school using life skill. So this is our model, which has 12 models with the 52 activities that can be done in schools and the colleges. As I already told you, but to integrate this program into the schools curriculum, where the teachers need to be trained, as we know that the life skill cannot be taught using lecture method. It's always, as I mentioned, it's an experiential model using various pedagogy. So it can be, teachers need to be taught to use this model, and they need to be trained as a facilitators, life skills facilitators, using different strategies. We have used pedagogy like games, role play, it could be debate, brainstorming, a lot of these are all the activities done using this pedagogy. The teachers are trained as a facilitators to how to do those activities in the classrooms as a life skills facilitator, for which they need to undergo training, 1 week training program. We usually conduct in the month of February or a March, once in 3 months or once in 4 months, we regularly conduct this training program. We by advertising in our website. If you go to the NIMHANS website, the information will be put up there. They need to have a prior registration and participate in the program. People from all over India and abroad also do come there to get trained in life skill facilitator. And I also run a certificate course on life skill training. It's a 4-month training course. So because of the COVID, we stopped it for a while. And coming year, we are going to advertise it in the website. And those who are interested can get trained in life skill curriculum itself and also in the workshop. So if you are interested, sir, definitely we would come to your campus and trained the different stakeholders how to use our model. And also we will share our model, which is available in Kannada and English also.
Normally we conduct teachers training program at KSTA.
Yes, sir.
At that time,
Yeah.
I thought we will request you for a few sessions.
Sure, definitely, sir. Definitely.
Thank you very much, madam, once again.
Good afternoon, Bharat sir. I am seeing you. I didn't know you were also there.
Yes.
Yeah, nice to see our own colleagues here. Yeah.
Yes, madam. Thank you for a wonderful presentation. With the permission of the chair, Ramesh sir, just I wanted to ask one question.
Yes.
Over to you.
Sure.
Yeah, yes, sir. No, excellent presentation. Like ma'am said, her support will be very helpful for to train teachers and students in under KSTA. Madam, I had one question. The Department of Epidemiology and Center for Public Health,
Yes,
they
sir.
also conduct these life skills program under Yuvaspandana,
Yes,
which
sir.
is under the government of Karnataka. That is the same as what you teach. Is it under the same program?
Yes, sir. So what definitely they use a model of WHO's of teaching this 10 life skills. But just by taking 10 life skills, generic skill, teaching them is not going to help. So we need to adapt the 10 life skills to the real situations of the children, isn't it? For example, children to how to deal with the exam anxiety. It could be how to handle the boy-girl relationship. Somebody proposes, what need to be told, or how to handle the peer pressure, or something related to addictions. It could be these 10 skills are interlinked. So how these 10 skills can be adapted to the challenges in the demands of the adolescent they have been going through. So our model talks about the 10 life skills, generic skills, which I have presented here, but we use 10 life skills to address the 52 areas that children undergo. As I mentioned, it could be motivations, academic related difficulties, relationship issues, substance abuse, suicide preventions, and enhancing the mental health and the well-being of the adolescent. These are all the sub areas which we are addressing using the 22 activities, not only the 10 generic skills. What is the difference between the epidemiological model and my model is that Department of Epidemiology, they teach generic skills. We use the generic skills to the situations for the children, which we identified based on the research outcome, which we did it in Kola, where we trained all the government school children, teachers in Kolar of 6 talukas, and we followed it up for 2 years, depending upon the issues they are having. Then we developed this cascading models.
Very nice, madam. Actually, to be honest, I didn't know about this part of the work that you have done. I knew you were working in the field of life skills, but I think KSTA will offer you a wonderful platform
Sure,
because
sir.
they have the best network with among colleges and schools and institutions.
Yes,
So
sir.
you in a single platform, you'll be able to reach multiple cities, towns, and colleges.
Sure, sir. As sir said that he requested that whether I can come down to their place and train especially the
Yes,
teachers.
yes, that will
Definitely, the
be.
model has been taken it even for where Adi Chunchandgiri Medical Colleges for the MBBS students. They have taken this cascading model to address the issues of the thing. We taught them a methodology and trained all the doctors as a facilitator, and they are implementing it. And they also have a lot of school programs from the Adi Chunchandgiri Mutt itself. They have a schools also. The doctors who have been trained as a community outreach activities, they are implementing this program through their community-oriented, community-based activities in the schools and the colleges also. So,
That's the need of the hour. Thank
need
you.
of us and that, definitely.
Thank you, sir. Yes.
Yeah.
Thank you, madam. Thank you, sir. Umesh Gatke, any questions?
There is one question.
Yes, sir.
Is it a good way to convince someone to control the anger management by giving past experiences or past examples, madam? Worst
By
experience.
giving?
By giving the negative impacts happened due to anger in the previous days or past days.
Yeah. Example of that.
Yes, ma'am.
Is it definitely if something undesired way of expressing the anger results in an undesired outcome also, that's also what is it, learning from them to keep in mind to better way to deal the anger situations when it occurs, isn't it? Similarly, even for the problem solving also, our decisions making also, when certain decisions are a problem solved in an unhealthy way, which have not derived in positive outcome, we can keep that experiences for the future issues, isn't it? Most of the time we implement it even as an administrator. It could be when it not derived a good outcome. If it's a derived outcome, definitely we will consider. If it's not an undesired outcome it leads to, then definitely we'll have an other alternative ways of dealing with that. Definitely one could consider those past experiences also to the situation to handle that, how no matter how difficult it would be.
Thank
Thank
you.
you, madam.
Any more questions, Umesh?
No, sir. No, sir. Thank you, sir.
Once again, on behalf of KSTA, we are very grateful to you for your very insightful and scholarly talk. As I requested you, we'll be contacting you in the coming days for a workshop on life skills for teachers.
Yes, sir.
We regularly conduct. Thank you, madam.
Definitely, sir. We also look forward. I would never say no to them, anything related to the children. And thank you for inviting. And it's pleasure to get associated and part of future activity with you. And once again, I thank all the audience also to be a part of this webinar. And at the end, again, thanks for the organizer, especially Mahesh sir, Dr. Mahesh sir. Thank you, sir.
I'm also very thankful to Dr. Bharat sir for connecting madam us and also being with us for the last 4 days. Sir, these 4 sessions have been very, very excellent for students to develop their ways of thinking. Tomorrow again, we have 5th talk by an advanced expert, and this is that is very important, especially on exam preparedness by Dr. Thomas Kishore, Professor of Clinical Psychology, MIMANS. I request all the attendees to join tomorrow also. Sir and Madam, thank you very much. And I thank all the attendees for being with us for the last 4 days for this webinar. I am also thankful to faculty who have joined, Dr. Vanita, Dr. Ratnakar, Dr. Vijayalakshmi, and Dr. Sapna Anigol. In fact, Dr. Sapna is a national awardee for teachers, National Teachers Award. This time she got a national award as a teacher. Thanks, madam, for being with us. We look forward to your kind support and encouragement for our future program. Thanks all the attendees once again. Thank you very much.
Thank you, sir. Thank you. Thank you, Bharat sir also. Dr. Bharat sir, thank you.